Neisseria meningitidis by Madison Dunham, Kate Bragg, Caroline Spencer, Caroline Ordazzo, and Michael Mark. Neisseria meningitidis is a gram-negative cocci bacteria primarily found in pairs, which is non-motile and divided into 13 serogroups based on its antigenicity. Various strains of Neisseria meningitidis vary in encapsulation, but the strains causing infectious disease or can be isolated from sterile sites are almost always encapsulated, which help to provide resistance to antibodies and phagocytosis within a host. Mucosal surfaces are often colonized through a process involving the pili, lipo-oligosaccharides, and surface proteins on the capsule. Identifying these serogroups involves the multiple outer membrane proteins present on the capsule. Neisseria meningitidis is a gram-negative bacteria which leads to the presence of an lipopolysaccharide or LPS layer, a thin peptidoglycan layer, and a cytoplasmic membrane. The LPS helps to identify the immunotype of each serogroup.
Pathogenesis is the biological mechanism that leads to a disease state. Neisseria meningitidis enters the nasopharynx, which is located in the upper respiratory system. It then adheres to the mucosa of the mucociliary epithelium, which is the layer of skin in the nasopharynx. Once it adheres, Neisseria meningitidis stays in a commensal relationship until the conditions are suitable for spreading through the host. A commensal relationship means that Neisseria meningitidis derives food from the host, but the host is neither benefited nor damaged. Once the conditions are ideal, Neisseria meningitidis crosses the mucosal epithelial barrier and enters the bloodstream, where it's able to quickly multiply. Once it's ready to leave the host, Neisseria meningitidis exits the host's body through both respiratory and throat secretions. Virulence factors are what makes an organism able to cause disease. Capsules work to evade the host's immune responses by providing some protection against antibodies, complement-mediated destruction, or phagocytosis. Lipo-oligosaccharides, or the LOS, is very similar to the lipopolysaccharide layer that's found in gram-negative bacteria. However, it lacks the repeating O side chain. Since the LOS has an alpha chain, it's able to mimic human antigens, which allows its escape from the host's immune mechanisms. Neisseria meningitidis is able to evade the host's primary defense mechanism of immunoglobulin A1 through the enzyme immunoglobulin A1 protease, or IgA1. IgA1 splits the hinge region on the antibody, which is located between the heavy chains, as seen in the image above. Once the hinge region is split, the immunoglobulin is no longer able to target Neisseria meningitidis.
Neisseria meningitidis causes a handful of serious infections that are usually referred to together as meningococcal disease. The first one that we'll talk about is meningococcal meningitis. Meningitis is something a lot of us have heard of. It's an infection of the lining of the brain and spinal cord of the meninges. It happens when the bacteria crosses the blood-brain barrier and gets into the meninges and causes an infection there. And it leads to swelling and can cause all kinds of problems. Neisseria meningitidis is responsible for epidemics of meningitis, where other causes of meningitis just cause single cases. But Neisseria meningitidis can be contagious. The early symptoms are flu-like and rapidly worsen. They start as the hallmark symptoms are fever headache, and stiff neck, but they can also include nausea and vomiting, photophobia, which is sensitivity to light, and an altered mental state or confusion. Another serious infection caused by Neisseria meningitidis is meningococcal septicemia or meningococcemia. This is when the bacteria infect the bloodstream, and it can occur with meningitis or it can occur on its own. It's a serious infection that rapidly becomes fatal. This happens because the bacteria is capable of evading the host defenses, and like its capsule layer will protect it from phagocytosis, but still some phagocytes will be able to engulf the bacteria. And when that happens, it goes into a phagosome, which then merges with a lysosome, which has enzymes in it to break down the bacteria. But in the case of Neisseria meningitidis, it is able to break down those enzymes. It has catalase, which breaks down hydrogen peroxide, so the phagocyte is unable to destroy the bacteria. And then the bacteria go on to multiply inside the phagocyte and take it over until the phagocyte eventually bursts, releasing lots of bacteria into the blood. From there, Neisseria meningitidis releases other toxins that break down capillary endothelial cells and cause bleeding. This leads to the development of small purple lesions called petechiae, which you can see in the picture here. It's a characteristic of meningococcemia that you get this rash. The bacteria releases other toxins that cause a widespread immune response. And when that happens, the host blood cells dilate and blood pressure drops, resulting in vital organs not getting the blood supply they need to function. This also causes widespread internal bleeding and can lead to shock, coma, and death. The signs and symptoms of meningococcemia include fever and chills, fatigue, the characteristic dark purple rash, vomiting, cold hands and feet, and severe aches and pains in muscles, joints, the chest, or abdomen. Meningococcal diseases are always serious, and they can be deadly when they're not treated. And even when they are treated, sometimes people still die from them. But if people don't die, there are lasting side effects. Meningococcemia can be so severe that limbs have to be amputated, which you see a lot in infants and toddlers that are affected by it. And meningitis can have lasting effects on the brain, including the ongoing risk of seizures, hearing loss, deafness, vision impairment or blindness, chronic headaches, paralysis, and cognitive problems, including learning disabilities and heightened anxiety. There is speculation that Neisseria meningitidis is responsible for Helen Keller's deafblindness in 1882.
There are also some side effects to this disease that are less severe, including memory loss, clumsiness, weakness and spasms, speech problem, and vision problems. The vision problems also can lead to going blind, but they don't always.
The optimal environmental temperature for the bacteria is 35 to 37 degrees Celsius, and given their proximity to normal body temperature, humans are an ideal host. The incubation period after initial infection is 1 to 14 days, where no signs or symptoms are typically present. The bacteria is spread through large respiratory droplets, of which are transmitted in close human contact. This would include the contact of relationships, roommates, and housemates. Neisseria meningitidis establishes a human carrier through mucosal adhesion in the upper respiratory tract. Twitching motility is the extension and retraction of pili and allows for the bacteria to pass and move through and across epithelial tissues while allowing for microcolonization. This interaction can be seen in the included photo, where the pathogen adheres and passes through the nasopharynx epithelium. The infiltration of the pathogen then continues into the red blood cells and establishes what is called tissue and meningeal infiltration. The damage done to the cell wall from the pathogen is what contributes and gives rise to the possible apparent rash of which was previously discussed. As the process is occurring, the evenly spaced pili of the pathogen allow for the uptake of DNA into meningococcal cells and performs bacterial conjugation. This gives access to endothelial cells and erythrocytes, in turn allowing for multiplication of the bacteria in a systemic infection. The infiltration of the pathogen into the red blood cell is also pictured.
The diagnosis of these diseases is made by a clinical examiner followed by a lumbar puncture to examine for permanent spinal fluid. The official diagnosis is done by growing bacteria from the spinal fluid. During the spinal tap, at the end, if a disease is present, it will show low sugar levels along with increased white blood cells and increased protein levels. Treatment for this disease includes breathing support, which is pictured to your right. During breathing support, the patient will receive more oxygen to decrease the rate of breathing. Another treatment is medication to lower blood pressure. Another treatment for this disease would be surgery to remove dead tissue. This would involve a surgeon going in and removing all the dead tissue that they can find so it does not continue to spread to other places. And the last treatment would involve wound care. Nurses or doctors would tend to any wounds on a regular basis, so hopefully surgery can be avoided. The prevention of this disease includes keeping up to date on your vaccines. One vaccine is called meningococcal polysaccharide vaccine. This vaccine is currently available in the US. The recommended dose is a single 0.5 millimeter subcutaneous injection. It consists of purified bacterial capillary polysaccharides. The effectiveness of this vaccine is well established, but is not well established in children under 2 years of age. The vaccine is good for about the first 3 years after it's been injected. High-risk groups should also get routine vaccines to make sure that they do not get any of these diseases. Another prevention would be maintaining healthy habits, such as hand washing, not sharing drinks or food. And the last prevention would be taking antibiotics at the first sign of infection. Some antibiotics that I found that work for these diseases is third-generation surfactotrioxane. And then another antibiotic would be penicillin G as an alternative. And this is our works cited page, and I hope you enjoyed our presentation.